Hi, Tom here, Menshealth Physiotherapist at Ramsey Health. Just a quick 2-minute explainer video on the male pelvic floor. So you can see here this 2D image of the male pelvic floor. We've got the bladder through here, leading through the urethra and the internal urethral sphincter, through the prostate, and then heading out towards the penis. So we've got three primary pelvic floor muscles that we focus on in terms of maintaining continence control. And that's our puborectalis muscle, which is a sling that kind of goes around the rectum back towards the pubic bone at the front. Now, this helps mostly with controlling our bowels, helping to pass out stools and hold back stools. We've also got our striated urethral sphincter through here, which pushes the opposite way. And that provides a nice closing pressure on the urethra to help with maintaining our urinary control and frequency and urgency. Bulbar cavernosus down the bottom here, it also pushes and opposes the striated urethral sphincter. So they can push against each other, a bit like when you're trying to kink a hose to increase the pressure back up the urethra to assist this urethral sphincter, which can be damaged during surgery and or radiation treatments of the prostate. How that looks like when the muscles are moving, we can see here. And so this is an ultrasound image of the male pelvic floor. So we've got the bladder through here, and we can see this little sphincter muscle here is coming across, and we've got the bulb of the penis here pushing up this way, and then the rectum muscle, that puborectalis muscle through this area, which is pushing up to lift the bladder up. And so we're trying to concentrate on training them separately. So we might try and train this part here through the rectum by itself, and then also focusing on towards the front of the pelvic floor to try and get some closing pressure on the urethra to help with things like maintaining continence